Hi fam, let's talk everything healthcare associated infections. So healthcare associated infections are infections that you acquire at a hospital setting. Under normal circumstances, when a bug infects you, they replicate and then the antibiotic is used, then they die, right? But with the multi-drug resistant bugs, they replicate. Even when the antibiotics is used, they don't die, they survive the antibiotic or kill the antibiotic. So that's why these bugs are important to know and to know how to manage them. As you can see, they are surviving antibiotics. They're not scared of antibiotics. This is because of overuse and inadequate use of different antibiotics. So these are drug resistant organisms, right? Or multi-drug resistant organism if they are resistant to multiple of these antibiotics or the drugs. So they can be not only bacteria, but in this case I'm going to talk about bacteria in the context of MRSA. So they have multiple drug resistance mechanisms, but what I want to highlight today is conjugation, particularly the plasmid transfer. So there's plasmid that are able to transfer the multi-drug resistance capability from one bug to the next. They are able to share that capability, and therefore all of them that are transferring or sharing that, they become resistant to antibiotics. So we won't even deal with only one bug, but multiple of them that are actually resistant to these antibiotics. So as you can see, these are turning into now superbugs because they get to be resistant to a wide range of antibiotics that are meant to kill them. So you can get infected by these HAIs as long as you are in a healthcare facility. So that's why it's important to minimize your contact with the healthcare facility, indirectly or directly from the environment, the healthcare workers, hands and equipment, as well as your visitors anyway. So we have published list of these categories of multi-drug resistance organisms that we need to take care of, divided into critical, high and medium by WHO. The critical category contains these bugs that need agent attention, from researching to get new antimicrobials for these drugs. For these bugs, because they're resistant to almost everything that's out there to treat them, and to also put in place measures to contain the transmission and infections of these bugs. Then we have high as well as medium priority. But these are the priorities of the multi-drug resistant organisms that we need to talk about. So I'm picking today the MRSA because of the question I've gotten, which is a medium in priority list according to this WHO. As you can see, MRSA is a methicillin-resistant Staphylococcus aureus, which is a group of bacteria that are resistant to common antibiotics meant to kill them, and they can infect your skin, especially if you have an open cut, an injury, even surgical wounds, a bite or burn or anything like that. They're transferable, or you can transmit through skin to skin, sharing of items and the environment that's contaminated, or even the medical equipment that are contaminated. Prevention entails regular hand washing, strict hand washing, not less than 20 seconds, the strict infection prevention control measures, which is dependent on the management of the healthcare facilities and the government to avail these resources for the healthcare teams. MRSA quick facts: we know that 1 to 2% of the population are carriers, so you are able to carry it and transfer to others. As much as you are carrying it, you can also self-infect yourself or transfer to others. So it's important to know who is colonized and separate them from the rest. We have contact precautions that aid into the prevention. So this is also good to know who is colonized, who is infected, so that you can strengthen and intensify those measures against these targeted groups, unlike the universal approach. Reducing antibiotic use, identify carriers, stop transmission, and eliminate reservoirs. These are a stepwise approach that you need to use, or as healthcare facilities and workers, we need to be applying to actually minimize this MRSA. So we have diagnostic tests. I'm not going to talk about the diagnostics, which is the last option in this picture. I'm going to mainly talk about screening because I'm into preventative care today, answering the question, because I was asked which test to use for screening. So we have two tests. One is MRSA Next Generation. As you can see, it identifies just MRSA. The second one is SA Nasal Complete. These identify both MRSA and MSSA. So MRSA is methicillin-resistant Staphylococcus aureus, right? MSSA is methicillin-sensitive Staphylococcus aureus. So the surgeons, before they take anyone to theater, they'd like to know what's your status. Are you colonized or not? Are you colonized with stuff that's resistant or sensitive? So it informs their targeted intervention. So to answer that question, SA Nasal Complete is ideal for preoperative screening, whereas MRSA NxG is ideal for surveillance, when you are surveillancing in the ward and you want to know who has MRSA, who doesn't, so that you can see who's isolated, who needs cohorting, who needs targeted contact precaution, and to inform them antimicrobial stewardship as well. Hope it makes sense. This is in the context of GeneXpert, right? Anyway, you can drop me a DM for any further question.